The so-called risk factors can be controlled very easily with drugs or intervention, but the risk is not ever removed completely. Now, second thing is, see, nature evolves, and we were like the snake. Let us say we evolved from the snake, from the monkeys, then we came up. In the snake, there is no coronary circulation at all, so the snake doesn't get a heart attack. Why did nature give us a coronary circulation to give heart attack? Probably we needed it. So now we have a special circulation for the heart itself called coronary circulation. There are vessels. Now this is a big business for us. Now we can always, when you go somewhere and say chest, or you go for a complete checkup, they first make you run on a treadmill. That's called GTT. You know, they not GTT. That's called TMT. They make you run on that, and then see the ECG. When you're running, the ECG usually is either up or down, so it doesn't really mean much. But they say it's borderline positive. Then they'll say we'll do an angiogram. Absolutely no idea, because angiogram is not a diagnostic test of anything. Because even school-going children, if you do an angiogram, they will have blocks. But when once you are doing an angiogram, they see a block and then frighten you and say, look, you have a block in this vessel. So I can't even let you go home. You must have an operation right now, or you must have a stunt. I call it a stunt, not stent. Right now. Then you say, why doctor, I have to go home and come. No, I can't assure you. You may go home, but you will. I can't assure you that you will come back alive. But if I'll tell you one very simple method to get out of that. You simply tell them, doctor, I'm sorry, I don't have the money. I'll get some money and then come back. They won't touch you. Then they'll say, don't worry, you can get some medicines, it's all right. But otherwise they'll say, okay, he's from EMA, then 10 lakhs is nothing. So I must bakraf him and get him and then do an angiogram and do it. Because how many people in India can afford 10 lakhs? And they, they frighten the wives first. They say, look, your husband's condition is very, very bad. Then she'll say, okay, I'll sell my Mangal Sutra and also get an angiogram done. So angiograms are done left, right and center for people. A lot of people send me an angiogram and say, now tell me what's to be done. So I tell them, I don't know what to do for the angiogram, but I know what to do for your father or mother, but I must examine them first. You see, today, clinical medicine has died. You go to the doctor, nobody examines you. They just write tests, a battery of tests, and then write about 100 medicines. It's like a laundry list. The other day, one very senior orthopedic surgeon in Madras, very famous name, he phoned me up and said, I want you to examine me. I said, okay, come. Then he came with a file, which is about this thick, from National Hospital in Singapore. He said, see, they have done all that and they have given these medicines, but I am not feeling better. I said, I must examine you. He said, what do you mean? They have examined me. See this whole file there? I said, I don't know. I am not treating that file. I am treating you, Mr. So-and-so or Dr. So-and-so. He said, are you serious? Yes, sir. I said, I'm absolutely serious. Strip down, take off your shirt, lie down, and I'll examine you. I examined him for about half an hour, didn't ask for any test, and I told him, you don't require any one of these medicines, throw them into the waste paper basket, and I'll give you one medicine, you'll be all right. And he is much better, and he's absolutely fine now. Now, he went and told his wife, who is also a doctor, that man examined me like a third-year medical student. She said, yes, that's the right thing. We were all taught like that. Have you forgotten that? Our teachers used to do that. That's called clinical medicine. That has died. At the end of the clinical medicine, you must have a diagnosis. And to refute that or to confirm that, you do one or maximum 2 tests. That's all what is needed. So, once in a year or once in 2 years, I just get my blood sugar done. And in case, I don't know, I'm not a diabetic, but in case I should be a diabetic, I just get a blood sugar done. And I also get a creatinine done to see if my kidney is okay, is up and running. So these kind of things, 1 or 2 tests, but today if you go, my God, fat profile, I believe, 100 things, LDL, HDL, ABCDL, it's caste system, like, this Kritias, Vaishyas, that kind of a thing. And now, very interesting thing, this week, yesterday, somebody sent me from America a data which said American associations of doctors have declared 12 things not to be done in medicine, because they are not only not needed, they can be dangerous. 1, this TMT test should not be done because it's not reliable at all. Its specificity and sensitivity less than 50%. 2, Colonoscopies, everybody goes after 50. If you say, I have got some tummy ache, the doctor will ask you to lie down and then put a tube behind at your bottom and then look through you. And in this process, he can even puncture the gut and give you a lot of problems. And this says does not help the patient at all. On the contrary, it can detect unnecessarily simple things which are made into big things and operated upon. So that's the second thing. Like that, 12 things are there. If any one of you is interested, I'll send the whole list to you for EMA and you can circulate to your members. Do not go to the doctors to get these 12 things done. Even it says, operating on a pregnant woman before the 39th week, for simply by saying that the child may be big, a child may come out, is not good because the child will not survive. Even if it survives, it's not a healthy child. So, lot of these things, 12 things are there. So, we do lot of things. We overdo lot of things which should not be done. So, medicine is not a very complicated thing. Medicine is a very simple thing. Now, who is the boss in the whole human body? The mind. And if you know how to control your mind, you can control your body, you can control your health, you can control probably the whole family, everything. And I always say, mind your mind and it will look after the other things. Now, a block in the coronary artery does not give you heart attack. An American doctor called Valentine Fuster did a study in New York where he did an angiogram on healthy 100 people and showed a lot of blocks and wrote down, if this man were to get a heart attack, he should get a heart attack here because his artery is blocked. And after about 15 years, he saw a few of them had heart attack, but none of them, mark my words, none of them had a heart attack where there was a block. So heart attack comes when the mind is unstable. Heart attack comes when the mind is filled with hatred. Heart attack comes when the mind is not in peace. And heart attack comes when the mind is agitated. So keep your mind under control. Even with all the vessels blocked, you will still be healthy. I had a patient about 40 years ago, at which time he was 50 years old, and his children brought him to me. And he had gone to Bombay for a checkup, and they had done an angiogram. All the vessels in his heart were blocked. Every single vessel in his heart were blocked. Every single vessel in his heart was blocked. Then I told him, how are you alive? So I saw the angiogram. I saw nature had done a lot of bypass already. That's collateral. So I told him, you don't have to have anything. You just be happy, you will be happy, and you will live as long as you live. His children thought, they said, oh, this village doctor, they're all in New York, you see. This village doctor doesn't know, we'll take our dad to America. So they took him there. So they took him to the Mayo Clinic and then told the Mayo Clinic doctor, see, this is our father, this is what happened, this is what the doctor said. The doctor examined him and then looked at the angiograms and said, ask your dad to go home. And he was a Catholic, enjoys a peg of whiskey. Ask him to have a peg of whiskey at night and enjoy life. He will now, nothing will happen to him. He doesn't require anything. So he came back. Do you know how old he is? 97 now, 97. And if you can see him in Mangalore roads, because he came and told me about a year ago, I feel bored, what do I do? So I told him, okay, I'll talk to the police people. You be the traffic warden. Instead of sitting at home, you stand in Hampankatta, there is a center of Mangalore, and drive the traffic. So now you can see this old man, 97-year-old man, standing in the road, main road, directing traffic. And the police have given him a uniform. So he is very happy about it and he will not die for some more time. So happiness keeps you alive. He did not have one block. Every vessel was blocked. Remember that every vessel was blocked. But nature does a lot of bypasses. This is what I want to tell you. One thing you must remember. Another fact is, your own body is built to last when it is first built and sent here. The maker, whoever he is. If you believe in God, you call it God. If you believe in nature, you call it as nature. Whoever made it in such a way that put a repair system also inside. Many garages have a repair system, repair shed. So that's called the immune system. And the immune system is inculcated into the body and inbuilt in the body so that whatever happens, the immune system will heal. Now, even if a surgeon does an operation, healing is done by the immune system. You see that? My former chief in Harvard, who is a Nobel laureate, did a very interesting study when I was a student there in the 90s. We had about 600 patients sent up for bypass surgery from various doctors in the Massachusetts area. And he had a team of scientists, and they found none of them, mark my words, none of them needed bypass surgery. So he devised a study to show how interesting it is. So at random, he had 3 theaters, theater A, theater C. In theater A, he said, you send the patient in, simply send the patient in, don't tell anything. You anesthetize the patient and operate, and then send him out. Theater B, you send the patient in, you anesthetize the patient, make him lie down, sleep for 1 hour, 2 hours, wake him up, and when he wakes up, tell him he is fine and send him away. Theater number 3, don't do nothing, but when he comes, you say, your heart is fine, and send him away. And now, after 10 years, looking back, theater 3, everybody is fine. Theater B, most of them are fine. Theater A, half of them are dead. The other half are still, having suffering from drugs and various other things. So, what is important is your mind. If you believe you are fine, and your body heals so beautifully, and it does it himself. You see, you have a cut. You just watch the cut. Within 2 or 3 days, the cut starts getting healed, and the 4th or 5th day, the skin completely heals. 5th or 6th day, the debris comes out, and the 7th or 8th day, you don't even see the scar. All this is because the body has got a mechanism which corrects itself. But you can spoil that mechanism. Ayurveda is all about keeping the immune system intact. That's what's called Panchakarma in Ayurveda, which keeps the immune system alert and up and working all the time. And periodic Panchakarma gives you a boost to your immune system. And when the immune system is fine, you are fine. When the immune system is not fine, you are not fine. But Western medicine doesn't believe in that because they want to have a molecule. Now recently, 2 scientists, Japanese scientists, one Japanese and one American scientist, they found out how the immune system cells work with the body cells when they need it. They showed that they have a hand, they shake hands and hug each other. And that can be made into a tablet or a molecule. So immediately, the drug companies caught hold of that man and made him get the Nobel Prize. Nobel Prize you think is all because of very nice things. No, Nobel Prize is also money. The drug companies influence most of the Nobel Prizes, and the Nobel Prizes are given by the drug company influence. So this man immediately gets a Nobel Prize. There is nothing new thought. Immune system is an old hat, and Ayurveda also knew about it. Nobody bothered. Now that they can make a molecule out of it, they have made a big thing and given him a Nobel Prize.